This is the eHealth 724 final project on golden grains, a chronic disease nutrition management solution. The question that this video aims to examine is, in Canadian adults aged 65 years or older, what is the effect of a camera-based nutrition mobile application developed with mobile health behavior change techniques on the management of chronic conditions, quality of life, and overall health compared to the usual prescribed nutritional guidelines? As the world becomes increasingly connected and technology penetrates all aspects of our lives, there's a larger potential for mobile devices to be used for personal health. Further, as the average life expectancy at birth has increased by 20 years just during the second half of the 20th century, the proportion of older adults, defined as individuals over the age of 65 years, has been steadily on the rise, rendering self-management of health to be pivotal in decreasing the strain on the healthcare system. More specific to Canada, older adults only represented 8% of the population in 1960, 14% in 2009, and this proportion is expected to rise to 25% by 2036 as the baby boomers reach the age of 65. With this increase in the proportion of older adults, there is also an increase in the prevalence of chronic disease, with 68% of older adults reporting the experience of a chronic condition in 2016. This has consequences for the healthcare system, as just 10% of the population accounts for 44.8% of all healthcare expenditures in Canada. In order to address the aging population and the associated implications for the healthcare system, the concept of healthy aging through modifications to diet has gained traction. Several studies have identified diet to be a modifiable lifestyle factor that can reduce the risk of and help manage chronic diseases. This is Dr. Dre. He's a physician who mainly manages older adults with chronic conditions. He's aware of the research that emphasizes the importance of diet and how modifying it can better help manage disease. But the question of how this can be done troubles him as he ponders the conditions of his patients. He thinks of Bobby. Bobby was diagnosed with chronic obstructive pulmonary disorder, or COPD, 2 years ago. He particularly suffers from chronic bronchitis that results from chronic inflammation within the airways, thereby leading to a collection of mucus, making it difficult for him to breathe. In addition to adapting his diet, Bobby knows that he needs to drink a lot of fluids throughout the day in order to thin the mucus so as to not cause excessive blockage of the airways. Bobby has trouble staying hydrated, as well as deciding on which foods are appropriate for him to consume. Dr. Dre also thinks of Cheryl. Cheryl was diagnosed with chronic kidney disease earlier this year. She's currently in stage 2 of CKD, which means that she has a mild loss of her kidney function. The doctors have informed her of the role that modifying diet could play in order to lower the acid load on her kidneys so as to slow the progression of the disease. Cheryl understands that she needs to pay special attention to her protein intake and has consulted a dietitian. However, she is unable to find the intrinsic motivation to follow the diet recommendations that are made to her. Dr. Dre also thinks of Hans. Hans was just diagnosed with having multiple risk factors associated with cardiovascular disease. More specifically, he was diagnosed with atherosclerosis earlier this month and struggles with hypertension. Hans has heard of the DASH diet, a diet high in fruits and vegetables and low in fats and dairy with an added component of decreasing sodium intake. Hans finds himself starting the DASH diet but is unable to continue following it for more than 1 week at a time as he has trouble adhering to the diet. Now, you might be wondering, what do Bobby, Cheryl, and Hans all have in common? Well, it's behavior change, or the lack thereof. Behavior change is difficult to achieve, and even more difficult to maintain, as humans are great at setting goals, but not nearly as great as attaining them. Many theories have been proposed to understand behavior change, including motivational and stage-based models. Motivational models are important in understanding why certain individuals make beneficial or harmful health choices. One model of motivational change is the health belief model proposed by Jans and Becker. This model takes into account the individual's perceptions of the expected outcome of changing their behavior, their perceived self-efficacy, and external motivation. Stage-based models rest on the concept that individuals are at different stages of behavior change. The most well-known stage-based change model for health behaviors is the trans-theoretical model of change proposed by Prochaska and DiClemente. This model has 5 distinct stages, including pre-contemplation, contemplation, preparation, action, and maintenance. Knowing this, is there a solution specific to patients with chronic conditions that integrates behavior change models within technology in order to encourage healthy eating? Can there be a solution that is unique to just patients with chronic diseases? Currently, many apps exist on the market in order to address healthy eating and exercise. More specifically, Carrot Rewards, MyFitnessPal, Fitbit, and Fujicate are popular apps that are used by many individuals. However, these apps only really tend to be appealing to the healthy subset of the population. This is why we propose Golden Grains. This proposed app helps individuals log their diets by allowing them to take pictures of their food and rewards them with points for eating healthy, as well as provides personalized reports as to how users should be modifying their diet specific to their chronic condition. Dr. Dre is intrigued and loves the idea of an app that uses a machine learning model to log food by just taking pictures and provides an educational component pertaining to specific chronic diseases, all topped off with a reward system for motivation. Golden Grains was a perfect solution for Bobby, Cheryl, and Hans, and it can be for you too. This rewards-based app grades your food choices and provides a gamification aspect as you can compare your grades to those of your friends. In terms of evaluation, usability testing for all possible end users and system acceptance test was conducted. Further, a randomized controlled trial is in the works to compare a control group of no mobile application users to those using Golden Grain, and an evaluation of user retention and quality of life will be assessed in order to demonstrate efficacy of this app. In conclusion, Golden Grains is a proposed app to help individuals with chronic disease to manage their diets through a reward-based approach in order to maintain healthy eating habits and get better.